The clavicle bone, Latin as small key, also known as the collarbone, is a long bone that connects the arm to the body. It is located horizontally and lies directly above the first rib. The clavicle bone is an important bone in the body because it provides stability and support to the shoulder and arm. Here are some details about the clavicle bone described below. Location. The clavicle bone is located between the sternum, breastbone, and the scapula, shoulder blade. Shape. The clavicle bone is an S-shaped bone, which is convex laterally and concave medially. This shape allows it to absorb shock and provide flexibility. Length. The average length of the clavicle bone is around 6 inches, 15 centimeters. Articulations. The clavicle bone articulates with the sternum at the sternoclavicular joint and with the scapula at the acromioclavicular joint. Function. The clavicle bone provides support and stability to the shoulder and arm. It also helps to transmit forces from the upper limb to the axial skeleton. Muscles attached. Several muscles attach to the clavicle bone, including the deltoid, trapezius, pectoralis major, and sternocleidomastoid. Blood supply. The clavicle bone is supplied by branches of the subclavian artery. Injuries. The clavicle bone is susceptible to fracture, particularly in athletes or individuals who participate in contact sports. A fractured clavicle can cause pain, swelling, and difficulty moving the arm. The clavicle bone is an important bone in the body that helps to provide stability and support to the shoulder and arm. Its unique shape and location make it a vital part of the skeletal system. The clavicle shaft has two surfaces: the superior surface, which is smooth and convex, and the inferior surface, which is concave and rough. It has two ends, the sternal, medial, end and the acromial, lateral, end. The sternal end is broad and flattened, articulating with the manubrium of the sternum to form the sternoclavicular joint. The acromial end is flattened and expanded, articulating with the acromion of the scapula to form the acromioclavicular joint. The clavicle shaft has three borders: the anterior border, the posterior border, and the inferior border. The anterior border is smooth and rounded, while the posterior border is rough and slightly raised. The inferior border is thick and triangular, serving as the site of attachment for several muscles. The shaft is slightly twisted so that the sternal end faces downward and the acromial end faces upward. The clavicle shaft is important for supporting the shoulder girdle and allowing for the full range of motion of the upper limb.